my name is Felicia Durr. I am currently in my master's program at Rutgers University on the Newark campus, and I'm pursuing my master's in biomedical science. I'm currently a pre-dental student and am applying for dental schools this current cycle. So my spring semester was definitely a change, but the transition wasn't anything that wasn't manageable. But when COVID came along, for me personally, it felt quite abrupt because I was hearing about the virus before in the news and everything, and it felt distant from the US. And then all of a sudden, for me, it kind of felt like everything was just like, okay, we're all going to go remote now and no more in-person instruction. So that was a change, but it was okay because we were already using recorded podcasts to watch our lectures on top of in-person lectures. And I used in-person lectures to grasp the information in one way, but really relied on the recorded podcasts to study. And so the change was different, but it still allowed me to learn the information. But my real concern was not being able to go into office hours to see my professors and my advisor, because I relied on those office hours to just get to know my professor better, learn the information that wasn't clear to me in lecture, and also to make sure I was on top of everything. But luckily, we were able to email a lot, and I still maintain a relationship with the faculty through email, so that was okay. COVID was a huge threat to the public health of the world, and with all the things happening, I wasn't really able to foresee what was going to happen, so I didn't consider delaying me applying to dental schools because I felt like I was ready. All the things that I've worked for were aligned, and I didn't really want to put my goals on hold if I didn't know what was going to happen. And also, being in my master's program, I saw that my program was able to adapt to the circumstances. And also, Rutgers School of Dental Medicine is under the same university, so they were able to still teach their students and continue with instruction, just with a change of teaching methods. And so even though the experience might not have been the same as others before me, I still wanted to apply to be able to continue my goals and move forth with my plan for the future. Yeah, in terms of schools keeping their students safe during this pandemic, I think that it's always a concern being in public spaces. My school personally at Rutgers, they keep us very informed about what they're doing to keep their students safe. For example, they send out a weekly update of how many tests for COVID have been administered, how many tests were positive and how many were negative. And they have a very extensive document explaining how they're going to start instruction again. So right now, all of my classes are remote, but they've made an exception for clinical instruction to be on campus. They've also created a task force to decide which students or faculty are recommended or required to take COVID tests. And so I think they're doing a good job monitoring the situation. So as modeling off of my school, I think that universities are kind of being forced to adapt to the changes. And there's always a risk, but I trust so far that they're doing the best that they can, because even with Rutgers, they said that if they see that what they're doing isn't working, they're not going to hesitate to stop what they're doing. Yeah, so I'm aware that the pandemic is changing how anything is going to go on. So to prepare for virtual interviews, I'm I think I'm going to have to practice like recording myself on like my webcam rather than just looking in the mirror, because I know that many of the interviews could be recorded and I want to see the perspective from the webcam. And also with practicing over the video camera, let me think. Yeah, I guess just practicing making sure to like look at the camera, and like I've talked to other pre-dental students if they've wondered like, oh, do I look at the camera? Do I look at the person? And just, I think it's going with what I'm most comfortable with. I personally think that looking at the interviewer makes me feel like I'm having a natural conversation. So that's probably the direction I'll go. But I am scheduled to interview with one school, and they're using their state's travel advisory list to decide which students can come interview in person and which can interview remote. And so that feels like it could help mitigate the situation. But it's always a concern because, again, going in person, it's a public space and you never know what students are going to have to fly in, and flying is obviously a bigger risk than just driving in. So being in a group of with students, considering also that the admissions committee sees multiple interviewees. So those are things to consider as well. Yeah, so let's think. So in terms of this pandemic happening and applying to dental school, my family hasn't really spoken about their concerns about me applying. I think that after the process of submitting the application, when it comes to going in for interviews, that's when they have raised eyebrows and they're concerned of whether I'll be safe, if the school is going to take action to keep us safe. And I think that it's a warranted concern because you never know with going into places that you've never been before or with people you've never met before. And with the field of dentistry itself, I was actually talking to my aunt, and she knows that I'm a pre-dental student. And she was like, good thing you're not a dentist now, right? Because she obviously is worried about me and current dentists being exposed to people's mouths. They're currently they're working in people's mouths, subjecting themselves to saliva and splashing. And yeah, so I think that people are just fearful of being around other people's germs. And obviously keeping the rooms clean and the instruments clean have always been a concern, but it's now more emphasized during these times. And so that's one of the things that my family has talked to me about. So starting my fall semester during this pandemic has been not difficult for me because I feel like I've had the experience in the spring. So it kind of just felt like a continuation in terms of their methods of instruction for the fall. And so our professors emailed us like a week before our class started with a description of the course and the syllabus and the first lecture slides, which isn't too different from how it would have been if it was in-person instruction. And I was prepared for watching all the lectures on podcast again, which was fine. It was also helpful because I think that the professors used their time to also figure out how to best help their students remotely. So one of my professors, for example, is scheduling weekly Zoom meetings to address any questions that students have about the lecture for that week. And he's open to not only email, but phone calls as well. So that's very helpful too. Yeah, so taking courses online or students having to take their courses with a pass or fail grade it would be concerning to me if we weren't in the circumstances that we are in, but I've attended a few Q&As with dental schools, and students have asked those questions. And I think dental schools are really understanding of what's going on and understanding that the situation isn't traditional to former applicants. And so I don't think they're gonna negatively view online classes or pass-fail classes during these times, even if they're prerequisites, because sometimes it's against the student's will and they're gonna have to just work with what's going on. So I wasn't concerned about, me personally, I wasn't concerned about taking my classes online because I didn't have a choice. And I think it would be a different conversation if it was my choice. And also, even if students did have the choice during these times, it's also a question of how safe they feel and whether they live with their parents or the condition of their health. So it's a lot of more factors to consider now. So before entering my master's program, working full-time at an orthodontist office as a receptionist, it helped really set in stone that I was passionate about dentistry because it allowed me to perceive dentistry in another view under the specialty and also the position as a receptionist. Because before I was a receptionist at this orthodontist office, I was a dental assistant at a general dentist office. So it was definitely a very different pace between the two offices, even though it's the same field. And being a receptionist allowed me to see all the things that go on at the front desk that are very vital to the functioning of the office. So I didn't think that it would be clinical experience, but it really turned out to be important clinical experience because you learn all things about record keeping, corresponding with other dental offices, making sure that the patients are up to date with their treatment and are aware of the treatment that's going to happen and the payments that need to be made. And also the insurance companies, making sure that insurance companies cover their portion, or a lot of times their patients have their insurance plans changed and they forget to tell us, or they forget to tell the patients. And so communication is really key, and it's something that you learn. And I think that I saw that dentistry a lot of times isn't going to be easy, and you go through a lot of problems sometimes during the process, but at the end of the day, once a patient has their treatment fulfilled, and if they're taken out of pain or given confidence, it's worth it. And I think that seeing both sides was important for me. Yes. So when it comes to applying to dental school during these times, some advice I would give future applicants is to make sure that you still follow a timeline that you can follow, that you can commit to submit all the things that you need on time. And also, even though these times are different and they're unsure, it makes you unsure about whether to reach out to people, don't hesitate to reach out to the people that you need to. So that's including like dentist offices to get your shadowing hours, or to your professors to ask for a letter recommendation, because I think that we're all in this together. We understand that times are different, and most people that I've had the opportunity to meet have been accommodating to the situation. So even for me, I wanted to become closer with one of my professors in my master's program to ask for a letter of recommendation. And I was concerned about reaching out because I was like, oh, he hasn't met me in person and he only knows me through email. Even though I emailed him a lot, I was wondering whether that would still be of value to him in terms of getting to know me as a person. But I reached out to him after people were encouraging me to, saying like, he'll be understanding, doesn't hurt to ask. And I did, and he was willing to help me out. And even though he only knew me through email and my performance in the class, he suggested we get to know each other through video calls, and it was helpful in getting to know each other. So I think people are willing to accommodate to these changes, and so that's important when applying.